You're live.
Okay. Hey guys, we're now going to do some male temple filling. This is a common thing for guys that exercise or that are usually about 5'10", have a little bit more substance to their body. Their metabolism is faster, so they lose a little bit of volume here. If you look at one side, it's got a lot of hollowing here. We just did some cheek contouring, chin, jawline. Now, what we want to do is really define and kind of build this out. We want to keep him a little chiseled, so we feel for the bone, our fingers on the bone, go right above that bone, all the way down to the bone. It's going to feel a little weird here, and then we just slowly inject. You might hear this, it might feel like it's going into your brain, but it's not. I always tell people that they may feel some pain when they chew the next couple days because we're going through the muscle there. But in general, the deep part of the temple, we're injecting a very thick substance filler called Radius. I need another half. Thank you. To give volume, we're going to come a little bit higher. We're going to go about halfway up, all the way down again, down to the bone. Perfect. You okay? Good. And we're now injecting the middle part of the deep temple. And this will also help the brow. And I always tell people it looks a little swollen and then it goes down. Good. And lastly, I need the define. As we move to the superficial part of the temple, I personally like a hyaluronic acid. So that's all filled out. You can see the difference if we look at one side. So we're going to use define. We're going to come up to this portion here, which is the superficial part of the temple. I'm going to go right on to bone, all the way down.
What are you injecting?
We just said that. This is Restylane Define.
Mm-hmm.
Down into the temple. We're doing about half a syringe. So he's got pretty hollow. Great. Good job. Hold on a sec. So now I want to show everybody a little alcohol. Gauze. I want to show everybody the one side versus the other. You'll be able to truly see a big difference here. So now, if we take a look at one side versus the other, there's going to be a significant difference. Okay, straight? Great. Now, the only thing is right here, if you take a look, come to the front, compare both, you can see very hollow there. However, right here, there's also a little hollowing. So let's grab that define. We're just going to do a little bit. On men, I like to keep a little bit of that hollow there. On women, we tend to fill it a little bit more. In men, I like to keep that a little bit, but because it gives a little bit of that masculine structure. But if you take a look at one side now versus the other, filled, not filled, much more blended, elevated cheek, filled out temple, defined, much more masculine in look and more healthy in look. So that's the injection of both deep and superficial temple for male facial sculpting. Let's grab the Radius. Okay. All right, let's go to the side. I want you to hold with your right hand right there. Nice and firm. Okay. Grab white pencil.
Do you want to keep it going?
No.
Okay.
All done.